Good morning. My name is Oladapo Gbenle. I'm the founder of Integrated Medit, and this is Adedeji Adeti. Is my partner. We are talking about health management system, which most people call EMR, but that's not just what we are talking about. We are talking about a system. We are building a system which we have incorporated into our package that give patient access to their data. What am I talking about? On Sunday, I was privileged to visit a hospital. So I have an emergency, so I had to take somebody to the hospital. And what happened is that some of the things that are the tests that have been run on the person were not available, and the doctor said we should have to start another test. And I was like, oh, we spent money, we've done a lot of scan. He said, no, I don't have it. And do you have it? Unfortunately, it was an emergency. We couldn't carry all the file along. I was saying, look, we have a system that you can just, everybody can just talk. You can get from the other guy some of this file. And it was just, and while we are still waiting, somebody came in also, which is the person happened to have access to health insurance, and the guy was there for almost 1 hour waiting to see the doctor. They have to verify his ID. They have to make sure he has paid, he has not paid. I was saying, what's all this stress? When we can create a system that can solve all these problems. You know, somebody is sick and you're making the person more. So I was just almost getting angry with the people that are attending to us. But that's not just it. What we are talking about is just not another application package. It's another system, which we call International Health Grid System, whereby I will be in Kano, and when I come to Lagos, I don't have to carry my file or carry a buckload of things to make sure that I will be attended to. No. All I need to do is get to the nearest hospital, access the hospital, and my record will be put down from the crowd. Or I can even ask the doctor that I have my record, all the data you need about me on my laptop, on my handphone, and the doctor can attend to me. You don't have to say I should go back to Kano. And I was giving an example of a military department, the Nigeria Army in particular, whereby they move their staffs from one place to another. And this situation where you move somebody from Kaduna to Lagos, and the person has a challenge, and you are asking the person, okay, I don't have your file. You have to start all over again. I said, if we deploy a system like this, which is designed for Africa, we won't have this kind of challenge. All we need to do is just make sure that this data is pulled into the cloud. Let me briefly describe the system. The system is built to automate health manager system from front desk to doctor consulting to pharmacy desks and to payments. And if you know the system we currently have, there is queue every year. I remember my person was not responding to treatment, and somebody suggested, let's take the person to General Hospital, where we have more experts. And somebody responded, do you know somebody there? Because I can never go through the stress. I can never face the stress that people go through in General Hospital. That's what we have. General Hospital people have to queue from the record office. You will queue to see the consultant. You will queue to make payments. You will queue to take your drug. You will queue. But I said, why can't I just do something like I do when I want to book a flight? I know that I will not see the doctor in the next 2 hours. Why can't I just, on my laptop, before I go to the hospital, check in, and doctor know that I'm already on the queue. And after that, I can just come, I know in the next 30 minutes, I will see the doctor. I can just go in and see the doctor. And why, instead of queuing to make payment, I can pay on my mobile phone while I'm still in the hospital. I don't have to join the queue. So that's the kind of system we are presenting. And our financial model, our financial is just as simple as this. As long as you are in our database, we make money from you. As long as you visit the hospital, we make money from you. As long as your hospital is running our system, we also make money from you as a hospital. As long as your HMO is integrated to our system, we also make money from you. And what are we looking for in this demo? We are looking for partnership. Because this is way beyond our capability. This is way beyond our capacity. Division is so large that we are looking beyond Nigeria. We are talking about international health grid system, which is cut across. We are looking for people in Kenya. If you travel from Kenya to Nigeria, you don't have to come with all you need to do is just go into the hospital that is running integrated medicine, and you will be good. You will be attended to. You don't need to do new registration. You don't need to do new verification. Thank you.
Thank you. Integrated Medics, a web-based application package to computerize any small or large-scale hospital while putting into consideration the complexities involved in the medical industry.